welcome to HC Medic. Today we are going to discuss about pathogenesis of tuberculosis. So let's begin. Tuberculosis. It is caused by mycobacterium tuberculosis, which is a gram neutral bacteria and acid fast bacteria. Tuberculosis is an example of chronic granulomatous inflammation. If we see incidence, TB or tuberculosis is generally found 95% cases are in developing countries across worldwide, including Africa, Southeast Asia and Latin America, and very few cases are found in the developed countries, and it is found higher in HIV patients. And HIV associated tuberculosis is commonly found in developed as well as developing countries. Now let's discuss about the mycobacterium tuberculosis bacteria. So this is how it will be found. In the Zn staining. So now let's discuss that how we can identify mycobacterium using different methods, diagnostic methods, and also its properties. So first let's discuss the properties. It is gram neutral, so we cannot use the gram staining method to identify it. But we can use the acid fast stain. So it's an acid fast bacteria. Another thing is it is a strict aerobe, so it requires high oxygen. It is also called Koch bacillus or tubercle bacillus. It has some species. It is a species and it has its own strains, including Mycobacterium tuberculosis hominis, which is found in humans, like infecting humans, and Mycobacterium tuberculosis bovis, which is generally found in the animals, but it can also infect humans if we consume unpasteurized milk. So it was seen earlier in the earlier times. Now let's discuss its shape. So it is a rod bacillus and slender. Now as you can see this in this, we will see this in the microscope. Light blue background, and pink slender bacteria. Now let's discuss that how we will demonstrate the bacteria. For demonstration we have 5 methods. First is acid fast staining, in which we use Zn stain. Second is fluorescent method. Third is culture method, which is best as it is the most specific. Then we can use molecular methods. For the demonstration, and fifth is we can use the serological test. For acid fast staining, we use the Zn stain, Zeal-Nielsen stain, and we find the pink colored bacteria as I have shown you here. Another thing is that this property is because of mycolic acid found in the cell wall of the bacteria. Next we will discuss about the fluorescent method. Fluorescent method, in this we use auramine dye and rhodamine dye, and this method is based that there will be fluorescence in the bacteria. Then we have culture methods where we use the Lowenstein-Jensen medium, which is the most specific for tuberculosis, but it takes 4 to 8 weeks for the result. So for rapid testing we use Bactec, which gives us result in 2 to 4 weeks. Okay, for rapid results. Then molecular methods, we use radioimmunofluorescent assay, and in serological test we check for the antibodies. Now I will discuss about the mode of transmission. It can be inhalation, which is most common, which leads to classical TB, that is inhalation of aerosols, which is in size less than 5 micrometer. Then it can be by ingestion of the self-sputum, which can lead to intestinal TB or laryngeal TB, but this is not quite common. Then it can be because of inoculation, seen in forensic studies, like people doing forensic examinations. Then there can be vertical transmission, that is through transplacental route from mother to fetus, transplacental, but this is rare. Okay, then let's see the spread of tuberculosis, how it is spread. It can be local, that is macrophages carrying the tissue. Like if this is the tissue and this is the surrounding tissue, then it will spread like this. Okay, simple way. Then it can be lymphatic spread, that is through lymphatic system. It can be hematogenous, that is through blood vessels, or it can be through natural passages. Natural passages include from lung lesions to pleura, lung lesion to pleura. It includes from kidney to ureter to urinary bladder. It can be in different ways, like transbronchial spread to adjacent lung segment, or tuberculosis salpingitis to peritoneal cavity, and swallowing of infected sputum. So there can be different methods in natural passages. Hematogenesis through blood, as I discussed, and lymphatics is through lymph vessels. Now let's discuss the pathogenesis. Now, as in this tuberculosis, the main thing we see is that there is delayed hypersensitivity reaction, delayed hypersensitivity reaction, that is type 4, and this is mediated by cell mediated immunity. So main role played is by cell mediated immunity, including the T lymphocytes, T cells. In this type 4 hypersensitivity reaction, we see that macrophages also play an important role as well as T lymphocytes. Now let's see the process of pathogenesis. So first, when the tuberculosis bacteria enter, that is mycobacterium tuberculosis enter, and it starts doing infection, we see that macrophages come to the place, right, for the attack. That is after 12 hours. After 12 hours of the entry of the bacteria, we see that there is macrophages coming up, that is progressive infiltration of macrophages. Okay, progressive, that is increasing amount of macrophages, progressive infiltration. Here there is role of complement factors. C2A and C3B, which play an important role as opsonization process. That is, they act as opsonins. Then in next step there is phagocytosis. And then there can be two fates. The macrophage can fight or it can die. In this case, it will release cytokines like TNF alpha and IL-1 and IL-1, that is interleukin 1. That is, there is increased synthesis of these cytokines, and then there is more proliferation of the macrophages. In the first case, when they will fight, they will kill the bacteria, but they can die themselves. In that case, this process will take place. Another thing is that T and B lymphocytes get activated. The CD4 plus T cells elaborate cytokines IFN gamma and IL-2, and these two will induce the delayed hypersensitivity reaction, that is type 4 hypersensitivity reaction. Okay, next is in 2 to 3 days we will find that there is formation of slowly granuloma. Now how this take place and what is granuloma? So let's discuss. Now here the macrophages will turn into epithelioid cell. This is macrophage which is turned into epithelioid cell. Here the cell will become little bit flat and the nucleus will also become slipper like, and it will become molecular and slender, and the shape will change into this, and they will look like epithelium. And such cells will surround completely. So we can see this type of picture where there are so many epithelioid cells accumulating together. Okay, next we will find that there are formation of giant cells. Now what are giant cells? Many macrophages come together and form giant cells which is multinucleated. Here we will find Langerhans type. In this, the nucleus is in this form, in the necklace form. That is, many nuclei are arranged in the form of necklace or horseshoe shaped. In the form of necklace or horseshoe shaped. Now after a few days, the same epithelial cells will be surrounded by the T lymphocytes. They will also accumulate in the place and will surround this epithelial cells. And after many of the few days, we will find there are fibroblasts surrounding this granulomas. This is called granuloma. Now let's understand this in detail. So we will have many things here. So first let's see. This we see are the epithelial cells. Okay. Second we see are the lymphocytes, particularly T lymphocytes. And here we see are the fibroblasts, which will convert into fibrous layer. And after 10 to 14 days, in this we will find in between there will be caseating necrosis, which is a characteristic feature of mycobacterium tuberculosis infection. So this whole region will be surrounded by a necrosis. How this necrosis look? So it will in the H&E slide, that is in this slide we will see that there will be pinkish eosinophilic structure and having fragments, having eosinophilic fragments like this we will find. Overall, when we see grossly we will find central caseating necrosis. Central caseating necrosis. So when there is presence of necrosis in this whole granuloma, it is called soft tubercle. And when this granuloma was not present, like before before the formation of this caseating necrosis, it was called hard tubercle. But then it will get converted to soft tubercle. Here we will also find the giant cells like this, which will have many nucleus. Fine. So that there will be presence of fourth type, that is giant cell. This is all about granuloma found in the tuberculosis, that is chronic granulomatous inflammation. Now we will see the fate of granuloma. So first choice, it can heal and it can get converted into fibrous tissue, and there will be dystrophic calcification in this case. And it may ossify after many years. In this dystrophic calcification, there is deposition of calcium in the necrosis tissue. Then next is the formation of cold abscess, that is the caseating necrosis will be converted into liquefactive. Then there can be formation of sinus tracts, that is when the TB is present in lymph nodes or joints, there are formation of sinuses, and this is called sinus tracts. And the fourth fate can be, it can get converted into fibrocaseous tuberculosis. So this was all about tuberculosis pathogenesis. In the next video, I will discuss about the types of tuberculosis, as this video has become so much longer. And thanks for watching the video. Peace.